and welcome to Science Spotlight, the first episode of our poster presentation series. In this series, we invite scientists to present their research posters and explain their work in an accessible and engaging way. I'm Bree Foster, science writer at Technology Networks, and I'm thrilled to introduce today's guest, Dr. Liliana Moreira-Costa. In today's session, Dr. Moreira-Costa will present her poster, which details the development of a simple swine model for chronic thromboembolic pulmonary hypertension. This model is designed to mimic severe pulmonary hypertension and right ventricular failure, providing valuable insights into this challenging condition. Hi, Liliana. Thank you so much for joining us today for the poster presentation. Could you tell us a little bit about yourself and explain the amazing research you have been doing?
Well, of course, thank you, Ree. My name is Liliana. I am a PhD at University of Porto. And first, I'd like to thank Technology Networks for this opportunity to share our work. This poster was presented recently at a scientific conference organized by RISE Health Research Network, which is the first associated laboratory Portuguese dedicated to clinical and translational research. So on this video, I will share with you our work on pulmonary hypertension and also the development of a new simple swine model to study pH with right ventricular dysfunction. So before we dive into the specifics, I would like to go briefly of what pH is. So, pulmonary hypertension is characterized by some key features: pulmonary vascular remodeling, RV hypertrophy, and also in some severe cases, RV dysfunction and failure. So, this condition leads to an increased mean pulmonary artery pressures and has been observing a growing incidence. However, therapeutic options remain limited. So, among the 5 groups of pulmonary hypertension, a major cause of PH is chronic thromboembolic hypertension, which I will be calling CTEPH. So this is a condition characterized by fibrotic obstructions in pulmonary artery. And most of the animal models for the study of pH, there are rodent and also large animal models. The large animal models are usually focused on CTEPH and typically involve the use of various embolization materials such as air, blood clots, microspheres, and are also sometimes combined with a surgical intervention. However, these procedures are complex and quite challenging, so they require multiple hits and also a substantial amount of time to establish these protocols. Also, these models demonstrate a clear pH phenotype, but do not reproduce the severity of human mean pulmonary artery pressures increase. So we aimed to develop a simple large animal model of pH by inducing a CTEPH phenotype, leading to severe RV dysfunction and failure. To achieve these, we used 2-month-old pigs and performed right heart catheterization weekly for 3 weeks, while continuously recording pulmonary artery pressures. In the CTEPH group, we injected long silk sutures into the left or right branch of pulmonary artery until mean pulmonary artery pressures reached 40 millimeters of mercury, or if we saw an occlusion of the left or right PA with fluoroscopy. So after this follow-up period of a few weeks between the embolization and the endpoint, we assessed cardiac function via ultrasound, also conducted pressure volume loops, and collected tissue for molecular biology and some histology studies. Regarding now the results obtained during the suture embolization into the left and the right pulmonary artery, we see clearly an obstruction of the branches, and also at the end point, we see that there is an occlusion of these 2 branches of the pulmonary artery. Also, during the implementation of this protocol, we saw a sustained increase in pulmonary artery pressures. Regarding echocardiography, we observed significant RV hypertrophy namely by this higher right ventricular wall thickness, and also a dysfunction of the right ventricle with a decrease in tricuspid annular plane excursion, the TAPS, and also with pulmonary artery acceleration ejection time ratio. So the suture embolization also resulted in RV dysfunction with significantly increased in mean pulmonary artery pressures, decrease in cardiac index, and also an increase in total pulmonary vascular resistance with significantly higher right ventricular and systolic and diastolic pressures. Also, we observed on the CTEPH group a decrease in ejection fraction. Regarding morphometry and histology studies, we observe an increase in heart weight and cardiomyocyte cross-sectional area. However, significant RV fibrosis was not observed among groups. Vascular remodeling, as you can see in this image, was also observed in some distal arteries of the unobstructed lobes. So as we are occluding the lower lobes of the lungs because it follows the circulation in the sutures go to the lower lobes, there is an increase in the blood flow to the upper lobes. So we see vascular remodeling on these, and also we see here an image of the sutures clotting on the lobes that are obstructed with our suture injection. Also, we performed gene expression analysis, and it revealed an increase in myosin 7 to 6 ratio and also an upregulation of the hypertrophy marker gene natriuretic peptide B. Isolated skin RV cardiomyocytes indicated a significantly increase in passive tension. Tension development from the RV of the CTEPH animals, and also a normal active tension progress, which increased with an increase in calcium concentrations. All these structural, functional, and cellular changes replicate human pulmonary hypertension features. This is a simple and reproducible swine model obtained by long silk sutures injected into the pulmonary circulation without the need of additional steps. Therefore, it holds promise as a valuable tool for preclinical studies on pH. So I'd like to thank again the opportunity to present our work. So thank you.
Thank you for that detailed explanation. It's such exciting work, and we'd love to dive a bit deeper and learn more about your research. So, can I ask why you use silk sutures?
Well, of course. So we aimed to conduct a study that was similar to what was published 10 years ago, I think, with a study regarding the use of microspheres and also silk sutures to induce CTEPH. However, this model was not that reproducible by us. We had some difficulties. The microspheres lead to some distal lesions, but something smaller and that does not reproduce what is the human CTEPH phenotype. And also they used silk sutures, but smaller ones and also in a lower number than in our study. And the lesion that they obtained was not to reproduce the human mean pulmonary pressures as we see in our work. So we aimed to stop the use of microspheres and to just focus on silk sutures. So we used larger silk sutures. And also in a higher number in each right heart catheterization that we did weekly for 3 weeks. And there is an advantage of the use of silk sutures as it is cost effective. We can find silk sutures in each surgical or research lab, so it is something that is not expensive and it can be used. And also with the use in swine, Obviously, in this model, we aimed to record the mean pulmonary artery pressures. We aimed to do echocardiography in each week. However, for something more easier to do, we can also just get an access, vascular access to embolize the sutures, and it is something that with practice it can be easy to perform.
Thank you so much. That was really interesting. What are the next steps for improving or expanding the applicability of your model?
So now the next steps, well, this was our first study to implement this model. Now we aimed to do more CTEPH pigs to increase the number, and also to test some other things, and also to compare it with other swine models of pH and right ventricular dysfunction, or RV hypertrophy, for instance. So we aim to compare this animal model with another one that we are implementing now, which is of the pulmonary artery bunding on a swine model. Which induces RV hypertrophy and also some functional changes. So we aim to compare these two for different outcomes, and to reach for different studies. But these are the next steps, and also to test some new drugs
Mhm.
that can be used for pH and also for CTEPH, and to improve the treatment options to patients with pH.
That's brilliant. I can't wait to see some results from that. Are there specific collaborations or technologies you're pursuing to further refine this model or explore related areas of pH research?
Well, so our lab is actually collaborating with several pharmaceutical companies to test some new drugs. And new drugs, and also some treatment options, and also to test some new devices. So the use of large animal models can become an advantage to preclinical studies to check the viability or the safety use of new treatment options, and also with the new devices, for instance. So our research institute and our university does gather to with some collaborative work with the pharmaceutical and industry. So we aimed also to achieve those goals with them, and also some other companies in the future. Yeah.
Oh, that's brilliant. Thank you again for sharing your incredible work with us, Liliana. We really appreciate your time and insights and can't wait to see more of you in the future.
Thank you.
Thank you for tuning into this new series. Don't forget to subscribe so you don't miss any episodes. See you next time.